Welcome to Raaonline. I am Dr. Sudakshina, Professor of Anatomy. Today we are going to talk on the spotters or the spot identifiers of the thorax region. So coming to the first spotter on the cadaveric specimen for the thorax, we have kept the heart. And here I have focused more on the vessels which are coming out of the heart. That is, the structure which is pinned over here is the pulmonary trunk. Sometimes we can pin the pulmonary trunk, or sometimes we can even pin the arch of aorta. So here what we have pinned is the pulmonary trunk. So you can see over here, this is the pulmonary trunk. Now let's go to the discussion, then you will be able to appreciate it better. So you can see this is the arch of aorta. So over here we can observe this is the arch of aorta, and this becomes the descending aorta. And pulmonary trunk is directly coming out from the right ventricle. Okay, so right ventricle, it is coming out and it is seen very well. Now come to the arch of aorta, just to revise so that we can now correlate with all the vessels. So the arch of aorta is giving three main vessels. Okay, so you are having on the right side the brachiocephalic trunk, on the left side you have the common carotid, the left common carotid, which is a direct branch from arch of aorta, and also the left subclavian artery, which is also a direct branch. Another less common branch but may be present is the thyroidema artery, which supplies the thyroid gland, which is also taking origin from the arch of aorta. Now let's come back to the specimen. So here you can see these are the branches of the arch of aorta. So this is the right brachiocephalic, then you have the common carotid, the left common carotid, and the left subclavian. This is the pulmonary trunk which goes up and gives the right and the left pulmonary artery, carrying the deoxygenated blood to the lungs, and the oxygenation is going to happen. So pulmonary artery is only artery in the human body which will carry the deoxygenated blood. Normally the arteries carry oxygenated blood, but pulmonary artery will carry deoxygenated blood and the oxygenation will happen in the lungs. Okay, now let's come to this. So pulmonary trunk, we can ask lot of questions. It can be, first of all, you have to identify the structure. Then the tag question can be where it is arising from, and where it is ending, or where it is carrying the blood. So pulmonary trunk is a short artery. It is transporting deoxygenated blood from the heart, that is from the right ventricle, towards the lungs. Some authors refer to this vessel as the main pulmonary artery or simple pulmonary artery. You can write it, because here the pin structure is the pulmonary trunk. So you can even write it pulmonary trunk. We will give you marks if you write it pulmonary artery. Then also we will be giving you marks. Okay, so now coming to the thing. So here you can see that pulmonary trunk is arising from the base of the right ventricle. Always remember, the right side of the heart is the venous side of the heart, which is having the deoxygenated blood. The left side of the heart is the arterial side of the heart, or carrying the oxygenated blood. But the pulmonary trunk or the pulmonary artery is arising from the venous side of the heart or the right ventricle. After passing behind the ascending aorta, it will split into right and left pulmonary artery to provide oxygenation to the lungs. So it will go for oxygenation. So you can see over here, this is the pulmonary trunk. Now this is going behind the arch of aorta. So arch of aorta will be crossing, and behind the arch of aorta, it is going to divide into right and left pulmonary arteries, which will be going to the lungs for oxygenation. So that is visible over here. Now let's see this diagram for you to understand how is the relations. So you can see over here, we have cut the arch of aorta over here. These are the vessels of the arch of aorta is seen. So this is the arch of aorta. So the arch of aorta is arised from the left ventricle, whereas the pulmonary trunk is arising from the right ventricle. And you can see the arch of aorta is anterior, and so it is behind the arch of aorta. The pulmonary arteries are dividing into two. Pulmonary trunk is dividing into two pulmonary arteries, the right pulmonary artery and the left pulmonary artery. So this is important for you to understand the relation of the pulmonary trunk. So don't identify it as arch of aorta. It is pulmonary trunk which has been pinned in this specimen. Okay, this is not pinned. This is the pulmonary trunk which is pinned in this specimen. So the correct identification is important. Now next, so once we have Here what else can we observe? You can see the trachea also. So this is the trachea which is dividing into the right and the left bronchus, more or less at the angle of Louis. That is where the manubriosternal joint, the lower border of T4 vertebra or the fourth thoracic vertebra is actually the level where we are calling the sternal plane, right? So, or the angle of Louis. So, at that level, all these changes are going to happen. So, the arch of aorta is also over here, the peaking of the arch of aorta, and then you have the pulmonary trunk is also dividing. The trachea is also dividing for the right into right and the left bronchus. Then the esophagus you can see which is continuing into the posterior mediastinum. The descending aorta is also beginning from here and continuing into the posterior mediastinum. So these are the structures which are visible over here when we do the dissection of the posterior mediastinum. Okay, so now coming to one important structure which we can ask you in the spotter, that what is this ligamentum arteriosum? So this is a connection, okay, between the arch of aorta, inferior from the arch of aorta to the pulmonary trunk. There is a connection or there is a tissue which will be present in the adults. This is a ligamentum tissue or ligamentous in case of adults, but in case of babies, like in case of fetus, because in the fetal circulation or when the fetus is in utero, the lungs is not functioning. So that we have to understand. So if the lungs is not functioning, the blood cannot go to the lungs for oxygenation. So most of the blood has to be shunted into the aorta, and from there it has to be sent into the placenta and maternal circulation for oxygenation. So that connection is a shunt, and that is the ductus arteriosus. In after birth, what happens? This ductus arteriosus closes because the left side pressure increases in the heart, and this is converted into a ligamentous structure, but that connection remains between the pulmonary trunk and the aorta and arch of aorta, and that is called the ligamentum arteriosum. This ligamentum arteriosum is also known as the ligament of Botallo or Harvey's ligament. So Botallo or Harvey's ligament. It is a small ligament which attaches the aorta to the pulmonary trunk. So small ligament which is attaching the aorta to the pulmonary trunk, and it is also called the Harvey's ligament or the ligament of Botallo. This serves no function in adults, but it is a remnant. In case of adults, it is a remnant of the ductus arteriosus. Now, sometimes we can pin that structure and ask you. So we can see this structure. You can observe here. This is the pulmonary trunk, and if we lift this is the structure which is called the ligamentum arteriosum, which is a direct connection in case of fetal life, and that shunt was called as the ductus arteriosus. Is now in this specimen, in the adult specimen, you can see that it is converted into a ligamentous band, and which is called the ligamentum arteriosum. So we can put this spotter for you, and you have to identify that spotter.